Welcome to the Wellness Connection with Dr. McMinn. Dr. McMinn is Birmingham's wellness doctor, practicing cutting-edge, world-class wellness medicine at McMinn Clinic in Homewood, Alabama. Each week, Dr. McMinn interviews experts in the field of integrative wellness medicine. The Wellness Connection brings you the information you need to optimize your health in mind, body, and spirit. And now, here's Dr. McMinn.
Good morning and welcome once again to the Wellness Connection with Dr. McMinn. This is Dr. James McMinn. I'm here as usual with our moderator, Misty Walraven. Good morning, Misty.
Good morning.
How you doing today?
I am blessed. Thanks for asking.
Wonderful, wonderful. We have a very special guest this morning. We have with us Dr. Roger Murphree. Good morning, Roger.
Good morning.
Thank you for coming in today. We're really excited to talk to you. Roger is an expert in the field of fatigue and fibromyalgia. I think it's an epidemic these days, don't you, Roger?
I believe it is.
Yes, absolutely. We see just a ton of it. And unfortunately, I think there's a lot of misinformation and a lot of lack of information about this.
Absolutely.
So we're going to discuss the subject today, and we're really excited to have you. Before we get going, let me tell you just a little bit about myself. I have a practice in Homewood, Alabama, practice integrative medicine. I am a residency-trained and board-certified physician and also currently on staff at the UAB School of Medicine. Now, once again, let me introduce Dr. Roger Murphree. And Roger, tell us a little bit about yourself, about your background, please.
Well, as you know, Dr. McMinn, I'm a board-certified chiropractic physician and nutritional specialist. I've been in practice 20 years, and my specialty is fibromyalgia and chronic fatigue syndrome. I'm the author of 5 books, including Treating and Beating Fibromyalgia and Chronic Fatigue Syndrome, and I have really pretty much dedicated my life to working with these individuals for the last 14 years of the 20 years I've been in practice.
Well, as evidenced by your many books out, Roger, and I've read them all. They're fantastic. We'd highly recommend it. Just name a few for us. So what are some of your books?
Well, bless you for reading them all.
Yes.
Well, the Treating and Beating Fibromyalgia and Chronic Fatigue Syndrome was the first book I wrote. It came out in 2003. Yes. It's now in its 4th edition in the bookstores. Heart Disease, What Your Doctor Won't Tell You, and Treating and Beating Anxiety and Depression with Orthomolecular Medicine. Then I've written some physician manuals, Advanced Clinical Nutrition for the Physician, and the self-help book for chronic fatigue and fibromyalgia.
Well, you know, yeah, I would highly recommend them, especially the one with the fatigue and fibro. It's a fantastic book, very practical, well laid out. Where can the patient get that, Roger?
Those books, fortunately, and let's hope this stays this way, they're available in most bookstores, Amazon.com, and certainly they're available on my website.
Wonderful. And so let's start with fatigue. This is not just a garden variety feeling tired, is it, Roger? This is something different.
No, when we talk about chronic fatigue syndrome, it's a whole other ball game. It's not like the fatigue that you and I may experience Monday morning after working in the yard all weekend.
Right, exactly.
I mean, this is totally different. You know, I describe it as the fatigue that you would remember if you had the flu from hell. This is the kind of fatigue that you wake up with and you think, oh my gosh, I've been beat by 2x4, I feel terrible. You know, I've got everything hurts. It hurts to even think. This is the kind of fatigue that the people with chronic fatigue syndrome experience. It's totally different than overexertion.
It's a flu from hell that goes on and on, isn't it?
It never ends.
Yes, it never ends.
Unless you find the right doctor.
That's right. Okay, what about fibromyalgia? That's a little bit different, isn't it?
Well, you know, fibromyalgia has a lot of similarities to chronic fatigue syndrome. In fact, I say they're the same coin, different sides of the same coin. And if you look at the symptoms of the two, they're almost mirror images. What separates these two is that the chief complaint for chronic fatigue syndrome is obviously the chronic fatigue. What makes it that is this immune system that's become compromised, and you can never get over this normally dormant virus that takes over the body. Fibromyalgia, you certainly have fatigue with that too, but the chief complaint with fibromyalgia is this diffuse achy muscle pain that just won't end. You can be at any end of the scale. A true chronic fatigue syndrome patient is going to be at one end of the scale, and for that individual, they're going to suffer with a poor immune function. So they're going to have chronic sore throats, they're going to have chronic infections, they're certainly going to have the fatigue, they're going to have achy all over pain. With fibromyalgia, though, they're certainly going to have fatigue, but oftentimes their immune system's fine. They don't get a lot of flu bugs, they don't get a lot of infections, they don't have chronic sore throats. Their chief complaint is this diffuse achy muscle pain. And for those individuals with fibromyalgia, they're all going to have a problem with sleep. They can't fall asleep, can't stay asleep. As you know, with chronic fatigue syndrome, they may sleep all day. They don't have trouble with sleep. And that's really how I separate the two. Now, as you know, those two syndromes oftentimes you can be somewhere in the middle of that scale. You know, you can have a blend of both.
Right, exactly. And I often consider sleep the first domino to fall. If you don't get over the insomnia, you'll never get over the problem.
Well, I don't care what you want to do. You can go to all the PT sessions you want to. You can take all the Neurontin and you can get a million chiropractic adjustments and massages. But if you don't get that deep restorative sleep, you're never going to reverse fibromyalgia, or if it's associated with the chronic fatigue syndrome or the chronic fatigue syndrome. That's how important that deep restorative sleep is.
Oh, it's huge. Now, in your books, you talk about an orthomolecular approach. What exactly is that, Roger?
Well, orthomolecular medicine is the kind of medicine you and I use. You know, it's integrated medicine. It's good medicine. And orthomolecular medicine was a term coined by Linus Pauling. You may, I'm sure you know him.
I do. I'm old enough to know him. The young whippersnappers don't know him.
Wait a minute, I don't know.
Well, Linus Pauling is probably the greatest chemist of the 20th century. So he's a 2-time Nobel Prize winner. He won it once in chemistry, and then he won it again in Nobel Peace Prize. And his claim to fame was all his research that he did with vitamin C. And of course, I think he lived to be 120. I don't know. I don't know what it is, but you know, the guy led a very healthy life, and he came up with the term orthomolecular because that means using the right medicine, right nutrients. And his theory was that disease is not a drug deficiency, but it's either a nutrition deficiency or an overabundance of some chemical that needs to be addressed. And the beginning of orthomolecular medicine really started with people like Dr. Abram Hoffer, who was some people may remember his work because he was the psychiatrist who did a lot of research on niacinamide, and that was made famous in the movie Awakenings with Robin Williams and De Niro. And part of what brought De Niro out of that coma-like trance that he was in was very high doses of a certain type of B vitamin, B3 niacin, called niacinamide. And that was the beginning of orthomolecular medicine, was psychiatry, using the right doses of vitamins and minerals.
Yeah, that's a fascinating concept. In fact, you have another book you talked about, you referred to earlier, treating anxiety and depression with orthomolecular. It's a fascinating book. So, Roger, fatigue and fibro have many friends, including things like insomnia, headaches, stiffness, irritable bowel, poor digestion, brain fog, and low libido. Are all these connected in some way?
Well, those with fibro wouldn't consider them friends.
Well, they hang around together, I'll put it that way. Right.
Yeah, you do. And as you know, that's what makes it so challenging as a physician trying to treat these individuals. And it also makes it challenging for the patient, because with so many symptoms associated with fibromyalgia, I've already mentioned the diffuse achy muscle pain, but they have IBS, they have chemical sensitivities, migraine headaches, food allergies, low moods, anxiety, depression. They have all these things, and when they present themselves to a physician, oftentimes that doctor will tell them, you're either lazy, crazy, or you got a Prozac deficiency.
That's right.
They just don't know what to do with these people. So it definitely can be a challenge, but there's some real common threads to these individuals that if you can unravel these threads, you can really make some huge changes in how they feel.
Roger, I'm blessed to work with the medical students at UAB, and I sometimes ask them, have you ever had a course on fatigue? And of course they've not. And so I think in the real world they get out and people present to them, and they have no alternative but just to treat these symptoms. They'll give them, of course, their sleeping pill and their anxiety pill and their this, that, and the other, but it's one drug after another instead of trying to get to the underlying root cause, orthomolecular cause, as you talked about. Yes. So anyway, Roger, you referred in the book to stress as a catalyst for illness. What exactly do you mean by that?
Well, I think that if you look across the board, just about every illness is linked to stress. Most doctors would agree to that, if they're being honest. But for the fibromyalgia patient and the chronic fatigue syndrome patient in particular, the studies show that those individuals have a very low plasticity to stress. Oftentimes, unfortunately, in childhood they were maybe sexually abused or mentally abused, physically abused. They had a very difficult childhood, or they had a some type of illness, or maybe they had some kind of chronic stressor in their life early on, so that as an adult, when they get under stress, they can't handle it. And many patients can remember the day when the straw broke the camel's back. They can remember, maybe it was a hysterectomy.
Right.
Maybe it was they came down with the flu and never went away.
Right.
Or it was a divorce, or a job where they worked 60, 70 hours a week. But something came along, and that was it. And if you look at the surveys of fibromyalgia, 70% of them will say that stress was what brought on their illness.
Yeah, I call stress the elephant in the room that doctors don't talk about.
Yeah, yeah.
All right.